Hello everybody, my name is Dr. Kevin Kurchiansky. I am the Director of Physical Rehabilitation at Triad Pain Management Clinic in Tempe, Arizona. A lot of our patients have asked us to put out an informational video regarding the SMRT procedure, which is something that we've trademarked here in our office, primarily to address the symptoms associated with primary and secondary frozen shoulder. A lot of times patients are unaware of what they will be walking into. We can only describe it through words to them. Hopefully this will be a resource for you in order to be able to see what actually happens to you on the day of the procedure or multiple procedures depending on your case. The technique is the SMRT procedure. It stands for Shoulder Manipulation Release Technique. This is a form of manipulation under anesthesia. What I'm going to do here momentarily is have Dr. Brandau demonstrate to you on one of our CAs, Alicia, how this procedure is actually performed, so you can see the extent of the movements that will occur to you while you are under anesthesia or under sedation. First, I'd like to briefly touch upon why you're actually going through this procedure. The lack of mobility in the shoulder is typically caused by capsule-related issues. Some people suffer from adhesive capsulitis, which is a primary frozen shoulder. It can be a very painful condition in which they actually lose the ability to move their arm. A lot of other patients suffer from a secondary frozen shoulder, and what that means is that it's secondary to another condition, usually other pathology, other tendinoses, other things that have been going on for quite some period of time. Ultimately, they lose the ability to have full range of motion in the joint. As we all know in the rehab world, any joint that lacks full range of motion is an unhealthy joint. It leads to other consequences, other compensation mechanisms. Usually with the shoulder, you're looking at a lot of compensation up here through the upper trapezius and the levator scap muscles, or what everyone just kind of refers to as their tension areas. The shoulder manipulation release technique is a modified version of something that's been done since the 1940s. Back then it was done very aggressively. I'll have Dr. Brandau here momentarily demonstrate for you how that was performed. And then I will show you, or he will show you, exactly how we go about the procedure nowadays. It is a much more gentle procedure. We mobilize the soft tissues as well as the joints. We have much less intra-articular or internal joint damage after our procedures. And we have about a 95% success rate with restoring full range of motion to our patients in all 6 planes of movement of the shoulder. We have Dr. Brandau and Alicia. They're going to demonstrate the SMRT procedure for you. This is for primary and secondary frozen shoulders, or anybody who has restricted movement in the neck and or shoulder. Dr. Brandau is going to start off by taking the head of the humerus and driving it into the back of the socket. What this does is orients the top of the arm bone into the capsule of the joint. He's just pushing straight down. What he then does is takes the arm and moves it through external and internal rotation, very similar to what we do for the hip. On a patient who has primary frozen shoulder, going into external rotation would be extremely painful, and a lot of times we hear popping and clicking when we do this under sedation. The next move would then be to keep the arm in the same position and put it into adduction across the patient's neck, almost kind of like they're choking themselves. He's going to drive the elbow back into the shoulder again, so that the head of the humerus is in the back of the socket. And again, all he's trying to do is break up the capsule tissue that's being, I guess that's a little sticky to the joint up there, and run it through the ranges of motion. After that, usually a lot of the capsule is broken up. We then take the arm through a variety of movements, beginning with flexion. We'll take the arm all the way up. Obviously, it's very easy on Alicia because she doesn't have this condition. After that, he's going to work through internal and external rotation in this same position, and all he's basically doing is doing stretches and mobilization techniques that would typically be very painful for a patient if they weren't under sedation, as you will be on the day of the procedure. The next move is typically a circumduction move, where he's going to hold the arm there and run the joint through all of the ranges of motion to try to break up any other adhesions. Do not forget that there is always a physician on the other side of the table who's responsible for stabilizing the joint. Sometimes these procedures are done a little differently depending on the pathology inside of the shoulder. If there are labrum tears or any kind of other pathology inside of the joint that we need to be cautious of. After that, we typically flip the patient over onto the side. Again, the nursing staff and doctors will do this. The arm would be pinned behind the back by one physician, and the other doctor comes through, grabs the back of the scapula, and moves your shoulder blade through a variety of movements to break up all the adhesions back through here. There is actually a pseudo joint back here, so this scapula can get fixated to the rib cage and the thoracic spine. We do this pretty aggressively, even to the point where sometimes you sort of lift up off the table. Again, it would not be very easy to do while you were under sedation, or while you were not under sedation. The next part of this is we take the arm into true abduction. This is a unique aspect of the way we perform the SMRT procedure. One physician stabilizes the scapula, which we can't show you right now, but you can just imagine holding her scapula in place, while the other doctor takes her into straight abduction. This is the movement that tends to free up the range of motion the most, because it's a true plane of movement as opposed to what typically occurs, which is a little bit of flexion in that shoulder. At the end, we lay the patient back on their back. He'll head up to the head of the table. One doctor will be stabilizing the shoulders to brace them down. And what he's going to do is run the patient through a series of neck stretches. Again, there's no manipulation. It is simply stretching out the upper traps, the levator scapula, and all the cervical paraspinals that attach to that upper portion of the shoulder blade and that are typically very tight and overactive. This is very easy, requires very little strength or power, and it helps to break up a lot of the adhesions that may be in the joints up there as well. And as you can see, there's not truly any manipulation occurs. It's just a deep stretch and mobilization of the joints. After this, the patient comes to into the recovery area and is typically able to leave the facility within about 30 minutes.